Was it a surprise? Was it planned?
I think I should see a gynac because I've never seen a gynac in my entire life. It's so wrong.
True.
And I got really scared. She's like, you're pregnant. We were like, what?
Is there an appropriate age that a woman should become a mother or should become pregnant?
Anybody needs to take that 2-year break.
2-year break?
So-
We don't know these things. There's no biological clock for men.
Well, a man can repopulate the world if he lives up to 110 also.
Was anyone who's like, now you should have children? Not just family, sometimes friends also.
You did.
I was about to say.
I just prayed for around 2 weeks where I had lots of vada pav. I'm not a vada pav eater at all.
Back in the year 89, and a woman came with a baby in her salwar. That holding the baby, the first baby crawl is so amazing that you forget all your pain.
Why is full-term pregnancy important? Is there a golden rule for a happy and a healthy pregnancy?
Let's go back to the trimester.
Pregnancy. It is a word that carries so many emotions. There's excitement, there's anxiety, there's hope, and there's this overwhelming sense of responsibility. I remember when I found out I was pregnant with Inaya, I felt joy, of course, but there was also a huge amount of uncertainty. And I had so many questions, so many fears. And whilst motherhood is absolutely beautiful, the journey towards it can be complex, it can be confusing, and honestly, it can also be lonely at times. And that's exactly why we're doing this episode, to talk about all the things that we wish someone had told us. The truth about pregnancy, emotional, physical, and everything in between. Hello and welcome to All About Her, a space where we have honest and meaningful conversations about women's health, wellness, happiness, motherhood, and self-care. And today's conversation is one that is close to so many hearts, pregnancy. And I really couldn't have asked for a better set of guests. We have two incredible guests with us today. Joining me is someone who is not just a brilliant actor, but who is currently living this journey. She is in her second trimester, and she has very generously chosen to share her experience with us. So please welcome Patralekha.
Thank you, Soha.
And alongside her, someone who has helped thousands of women through this transformative phase of life. She's India's leading gynecologist and obstetrician, Dr. Ranjana Dhanu. Thank you for joining us again.
Hi.
We've had you on the show
And
before.
congratulations, Patralekha, and welcome.
Thank you, doctor.
It's a really exciting phase in life, and I'm so happy that you're here to share a little bit about it with us. Patra, thank you. In my introduction, I didn't say that you're also a very good friend of mine. That's perhaps why we also come. But a lot of people don't. I think when they're pregnant, they generally sometimes don't even step out of the house.
Yeah, I agree with them because, I don't feel like stepping out at all.
Yeah.
I mean, just because you are such a good friend of mine and I love you so dearly.
Also, you went out last night.
That's because that was another dear friend.
And you're working a lot.
I should
You have a lot of dear friends. And you're working and you're
Yeah.
traveling. And that's, I think, how people are being pregnant today. Perhaps it wasn't like that some time ago, but I'll come to all of this. But firstly, many, many congratulations. Can you take us back to like the moment you found out that you were pregnant? Was it a surprise? Was it planned?
See, we have been seeing each other, knowing each other, married to each other for like now over.
Oh, I thought you were talking about you and me first.
No.
I was like, married to each other?
No, Raj and I for 15 years. And I thought this would just culminate into like a family thing eventually. So this year at the beginning, I was like, let's try. And so we tried, and then I very sneakily called for the test.
Yes.
Which came negative. Then I was like, oh my God, what does it take? That's why I asked how many times should I see a gynac? Because
But I can tell you that it's not just like you do it once and it happens.
yeah, I know. So anyway, I called up my other friend and I was like, listen, I think I should see a gynac because I've never seen a gynac in my entire life, which is
That's
so
not
wrong.
true.
That is
Firstly,
true.
can you get to, we're not disclosing age or anything, can you get to the stage in your life and only go to a gynecologist once you're pregnant?
Well, in today's era, like I said, you start to see a gynecologist right from your teens. If you have mood swings, if you have acne, if you have irregular periods, if you have puberty menorrhagia, which is heavy periods.
There's lots of reasons, but okay.
Yes.
Yeah.
Then good that there was no pressing need for
No,
you.
honestly, I'll tell you also why. Because I got scared. When I was about 21, I started getting not irregular periods, but not like great flow.
Right.
And then I went to a gynaec. She gave me birth control pills, and I got really scared. I didn't live with my parents then, so I didn't know what to do. So I just took a flight, and I never went back to her. Never took those pills, and then I got on to the Ayurvedic journey, which also kind of helped me. I don't know if it's. I mean,
We will talk about the Ayurvedic journey.
Yeah.
But first, tell me. So
So
then you did the test. It was negative.
Yeah. Then I called up my friend. She said, "Oh, you must go see my doctor." And I said, "Sure." I went to Dr. Neeta Varti, and I told her, both I and Raj, both of us went, and we were like, "We want to conceive, doctor. How do we do this?" The doctor's like, "Since you're here," and also I said, I have had symptoms of PCOD. Then she was like, "Okay, why don't you go and get a scan? Are you comfortable with that?" I was like, "Sure." So we go get a scan, come down, and then she's like, "You have a sac." I said, "Sac?" I and Raj looked at each other, and she was like, "Yeah, you have a sac." And then we were like, "Oh, okay, what does that mean?" She's like, "You're pregnant." We were like, "What?"
That's an insane story.
Insane. Yeah.
And then that feeling like how did it feel?
We were just, because, we didn't have to
Go through any kind of, you were like thinking, what all do we need
What
to do?
all, yeah.
And
we were just happy. But also I feel like we were ready.
Yeah.
We were ready to have a baby.
Yeah.
So it just felt okay.
I'm so excited. There is so much, Dr. Dhanu, that I want to ask about this amazing phase in a woman's life, in a couple's life, in a whatever, the partnership's life. But this phrase, the biological clock, how much truth is there to that? Is there an appropriate age that a woman should become a mother or should become pregnant?
So when you were decided to be girls in your mother's wombs, your basket of eggs was already decided.
Yes.
And when you attained the menarche is when the basket of eggs became even smaller.
Menarche is when you start getting your periods.
Yes. So from a 2 million, you come down to a 70,000.
Wow.
And then you have an exponential egg loss with each period that comes on. So in each period, it's not just one egg, but you recruit 3 to 4. And there's one egg that's released. So what happens at 30 is subfertility starts to set in. Subfertility means your fertility level starts to fall. But today, with girls indulging in habits, smoking, vaping, alcohol, sleep deprivation, social media, bad habits,
these are bad habits,
eating out of packets.
Right.
So all this is leading to a lowered AMH, which is anti-Mullerian hormone. Plus, if they have certain issues with their ovaries like cysts or dermoids or endometriosis, then that further causes a problem with their fertility and their AMH. Also, if they have had multiple sexual partners, today you see how girls are indulging in sexual activity right from their teens. By the time they want to get married, they've had a couple of sexual partners, so that can lead to STDs and tubal blocks. So all these are issues that come in the way. But what happens with the biological clock is if at 30 you don't start to look at your AMH, then slowly and steadily at 35 it even further deteriorates. And then the fear at 35 to have chromosomally deficient or altered kids, the most common being Down syndrome and other issues. As you know, Down syndrome in simple language is Mongolism.
Right.
So that's a problem with trisomy 21, wherein the child is, of course, it's compatible with life, but they have a mental subnormality. You can physically make out that they're extra friendly, but they have straight hair, low set ears, or a web on the hand, and they're mentally subnormal, so they may or may not have cardiac issues. So
These are risks that happen at the age of 35.
35 and above. So that's when the chromosomal defects start to increase, more so after 40.
Okay.
We do see girls today who want to be more and more settled in their careers.
Yes.
So they're not ready for having babies. So that's when egg freezing comes into the picture.
But doctor, I had also frozen my eggs about three years back, I guess. And now that I'm pregnant, I feel pregnancy was way easier than freezing the eggs. My doctor didn't tell me then that how difficult it was going to be. I had gained weight. Anyway, that was not
the problem because you have to take certain injections.
Correct. Also, the blues that I had once, my egg freezing was done. So between the two, I would always recommend the young girls just get pregnant. It's just easier than going through that whole process.
Honestly, I think you have to handhold, and we do a lot of counseling and we make girls understand what it's going to be like, because you're eventually super ovulating a girl. What is to super ovulate? Naturally, you're growing one egg or a couple of eggs, but when we super ovulate, we're controlling your ovaries with certain hormones, and then we're super ovulating you and then retrieving your eggs. So in young girls, we can get all those eggs in one cycle.
Right.
In older girls with a low AMH, we have to pool the eggs. So that's again extra hormones. So you have to actually handhold girls. And what we do is we work on their diet, we work on their weight, we look into other hormones like prolactin, thyroid, which could be associated issues, giving them mood swings. So you have to actually handhold all girls and then
the process.
So also I feel like you have to find the right doctor.
Oh, yes.
That's very important.
Yeah. I think that's also hugely important, and I think we have today, certainly. Male fertility. There's no biological clock for men?
well, a man can repopulate the world if he lives up to 110 also, but healthily. Like girls have a limited reproductive age from the age of menarche, that is from the time they start menses to the menopause,
Right.
which varies from the year 41 up to 56, because I have patients who don't menopause up to 56 or 57 because they've led very healthy lives. They've never smoked, they've never had any habits, so they have lived healthily, and we can see a late menopause.
Right.
But in men, of course, if they lead healthy lives and if they don't have any lifestyle disease like hypertension, diabetes, obesity, cardiac issues, and if they remain fit, their sperm cycle never really gets altered, and they are potent enough to repopulate the world at the age of 107 or 110 if they live long. Wow. But if they have issues or like with habits and stuff, then the sperm quality can get affected. But when it comes to evaluating a couple for fertility, we say 50% of the responsibility is that of the girls and 50% of the guys.
Yes.
So the guys' 50% is the quality of the semen.
Yes.
And his ability to have a natural act,
Yes.
a natural biological sexual act,
Right.
spontaneously. And for the girl, there are different things that we need to assess, which is a sonography to see that the uterus, tubes and ovaries are all normal in size, and the tube-ovarian relationship is maintained. So in case a patient has had a previous ovarian cyst or a tubal disease or fibroids or previous surgery for endometriosis or any adenomyosis, then the tubes and the ovaries are not connected to one another, or the egg pickup may kind of be a problem. So if a girl, after taking fertility-inducing drugs, does not conceive naturally, then she needs to look into her tubal patency.
Right. But I think that's very important that you said it's 50-50, because I feel like a lot of times women, if you're not getting pregnant, then women are doing lots of things. Sometimes it's as simple as a man
This
just
is only
getting
the
its fertility
structural
test.
bit, but the hormonal bit also needs
Also
to be
comes
checked. So then the AMH, the prolactin, the FSH, if she has clinical stigma of PCOD and whether the male hormones are dominating or not, plus other issues like thyroid or whether she has any cardiac defects. So very rarely when you auscultate 10,000 patients is where you'll find one girl with a heart defect which has gone unnoticed.
Right.
Or you could have somebody with previous lung disease, or I've had patients with renal disease. So
some
these days we have patients, well, where I practice, usually we have patients coming to tertiary care wherein they have renal disease or they have heart disease, so all complicated pregnancies, and those are the ones we handled.
I will ask you a little bit about what we need to look into before you get pregnant in terms of your general health. But I feel like also in India, I wanted to ask you, Patra, was there any family pressure? Acha, abhi, now you've known each other, you said 15 saal, 15 years. So was anyone who's like, now you should have children? Not just family, sometimes friends also.
You did.
I was about to say, like, where someone was saying, yeah, have kids. Yeah.
And my mum did. And
I just want to clarify, I didn't pressure you.
you didn't pressure me.
Just
You were like,
suggesting
yeah.
that it might be fun.
Yeah. Where did you draw the line? No, but no, my mum was very, she was not excited. She really wanted us to have a baby. She loves kids. And after 2 years, she was like, okay, you guys can go screw yourselves. I'm not going to ask you anymore. You guys come and tell me when you guys are pregnant. And then I saw you, we went on some holidays, a few holidays with you and Kunal. And we just saw Ini and we were like, oh my God, this is amazing. And like I said, it was just a natural progression.
Yeah.
Honestly, we really don't
Succumb to pressure.
To pressure, yeah.
That I know.
Yeah.
But some women do. And I just wanted to understand that societal pressure. Is there some way that we can gently push back? with
A
families?
lot of societal pressure, I must say, and you can't just say that it's in the tier 2, but it's also
Yes.
existing in the metro.
Oh, yeah.
Also in the very affluent class as well, and so much so that they also have a gender
Yes.
pressure, preference as well, and they keep blaming the lady or the girl for not being able
Even
to.
though we know the XY, XX.
Exactly. So the male is all responsible, whether it's going to be a boy. But still, girls do suffer. And actually, I've had educated women also facing the wrath of a mother-in-law when a girl has been born, and she was actually a doctor by profession, and the mother-in-law kept staring at her so angrily that she couldn't just get her lactation and a letdown reflex.
Oh, no.
To a point where I told her husband, who was a cancer surgeon, to please take the mother home. And then we counseled the girl, and she was fine because she said the pressure was so intense that it's unbelievable. So it does happen in society. But also today what we feel is couples have to look into their interpersonal relationship, one, to be secure financially, to really give that woman that space as to whether you're really prepared to have a baby. And of course, husbands today are very, very forthcoming, and they are very welcoming, and it's not just a ladies issue anymore because we have more and more nuclear families today.
Yes.
So I think it's a good
Husbands are I think
thing.
now they're showing up.
Yes.
You spoke about a few things like interpersonal relationships and financial stability, which are key. What are the top 3 things that women are worrying about when they become first-time mothers that perhaps they shouldn't be worrying about?
Well, the first thing is, what will happen to my job in case they are working in, and I have a lot of corporates, so then they get jittery, what's going to be happening to
Definitely in
my
our
job?
industry, I was about to say. I mean,
And then I tell them that anybody needs to take that 2-year break. So however ambitious you are,
2-year break?
a year and a half at least. No, a 2-year break as far as pregnancy is concerned, because you have to slow down somewhere. I'm not saying you go off work totally, but you have to give yourself that little space, that little time. You can't just deliver a baby and put the baby in the nanny's arms and run off to work.
Yeah.
So you have to understand that you have to take a step back. And I, of course, sit down with my patients and I tell them, look, you have the spark within you and you're going to bounce back there. But do justice to your pregnancy, to your emotions, and to your baby.
Yeah.
Because if your husband could carry the baby in his peritoneum, he would definitely do that in his abdominal cavity. So
we don't know these things.
He would happily do that. But physiology is such that you are the chosen one to have a baby in your womb, and so you have to give yourself that time for motherhood, which is so amazing. I'm a mother of 2 kids. You've seen them, you meet them, you work out with them.
Yes.
So it's amazing.
Have you thought about that? Getting back to work and work-life balance?
So I thought that I'd give birth whenever it's coming. And then within like 30 days, I'll be up and about to go. But as time is passing, I'm just...
No, my love, you know what? It's your emotions.
Yeah.
So you get so bonded to your baby, and you become a light sleeper. So when your baby even does it like in the cradle or bassinet, you are there as a light sleeper to wake up and see what. So that's nature's way of bonding you. You may not want to then socialize much with your friends because your baby is totally dependent on you. And once the baby becomes a toddler, then you get back to your. That's quite normal.
So I had spoken to you about it, and Kunal also, do you think I'll be able to get back to work?
Yes, I remember.
And then you guys were like, no, why do you want to do that?
I mean, I know that I also chose to have Inai a little late in life, and I knew that also because I get obsessed. I got obsessed with my husband also for some time and forgot everyone else. So I tend to get obsessed, and I knew that that was going to be my world for some time. Yeah. And only recently have I actually started stepping away. And I think that you have to just do what makes you happy, and but be in tune with what it is that you want.
Yeah.
The usual thing is, as long as it's coming from within you and not from pressure from without.
No, also, but the life of an actor, there is a lot of pressure.
Yes.
There are working hours, and you need to wake up early. You need to. So I don't think so I can deal with that kind of pressure at the moment, because honestly, I'm loving the journey. I was quite scared to take this journey as a young girl, but I feel like I'm so comfortable where I am, and this is what makes me so happy right now.
Yeah.
And I'm happy to be in this journey, and I don't want to look left and right. I think everything will fall in place if it has to.
Right.
We have delivered girls from your fraternity and they've bounced back so well.
Yes.
Yeah. So just because of their right to privacy, I can't name them, but they're doing so well. They've bounced back.
We see that.
In 3 months they've gotten back to their exercise and work, and they've had a couple of releases.
Yes.
In a year and a half. Of course, a lot of support system with the husband and the family and the mother traveling to different locations. I think it works really well.
Yeah. So many voices when you're pregnant. So many people telling you what to eat, what to do, all these Nuskhas. There's apps, there's influencers, there's aunties. Are you taking that, handling that, filtering that, ignoring that?
I mean, I do what I feel like is the best for me. Initially, I was eating out a lot. And then I
ate out one of those meals with you?
Yeah, and then I felt really ill where I had to go to the doctor at night around.
In the middle of the night?
Yeah. Because I had gotten such a bad acid reflux, doctor. And, I had eaten some raw stuff, which I shouldn't have had. And that was a big learning curve. I had to go through that because I don't listen to people. And then eventually, I just feel like I don't have any cravings, which is very weird. I just prayed for around 2 weeks where I had lots of vada pav. I'm not a vada pav eater at all. It was just super strange. But I think I'm just eating home cooked meals, small portions, many a times. And I finish eating by 6 p.m. in the evening, which I feel like is helping me with my acidity also. So, and then I go for a walk for around half an hour, 40 minutes, depends what I can do that day.
Yeah.
And I think that's really helping my gut and keeping me.
So we normally say you must eat your last meal, your dinner 2.5 to 3 hours before going to bed, because
That's generally in life.
gastric emptying is 2.5 hours. So it works well. Plus your pregnancy, now that it's growing, it's pushing the intestines up. The intestines are pushing the stomach up. The stomach is pushing the acids up.
Yeah.
So if you settle down with your digestion properly before you go to bed, it really works well.
Works well.
Yeah. We normally tell our patients in the first trimester that you're not supposed to eat sushi, you're not supposed to eat raw foods.
When I was sitting
You're not supposed to eat roadside food.
Yeah.
So all those are the don'ts. Nothing cold, no salads from outside, however fancy the place is. So all these are the don'ts that are told to them.
I'm not looking at you. I'm just like, I told you so. But so many questions I have about nutrition and exercise that we'll come to. But if you could just take us through the process of pregnancy, especially in the early phase, from conception to implantation, what's actually happening to the body?
So conception ideally happens between day 11 to day 17 from the time you get your the last menstrual period. So when you actually find out that you're pregnant, you're already 5 weeks plus. And then girls say, oh, how come I'm 5 weeks? And then I say, it's not from the time that you conceive, but from the time your egg started to grow, which is the first day of your last menstrual period. So the first trimester, that is the first 3 months, is the period of organogenesis, wherein all the different organs of the baby are being formed. So you've got to be very careful about your intake of any sort of medication. Now that we're seeing a spurt of dengue and malaria and whatever, if you go to a local GP who just gives you some green, pink, blue, yellow tablets, you don't know what you've taken, we don't know what you've taken. So it could have lifetime implications of the baby's development. Especially there are certain drugs like doxycycline or whatever, which are absolutely contraindicated in the first trimester. So you need to be careful about your intake. So you need to see a doctor the minute you diagnose that you're pregnant.
Antibiotics
Antibiotics, we have a safe basket of antibiotics which we can give you. Then also radiation exposure. So girls working in corporate firms, when they pass through the X-ray screens every day in and out, that's something that is radiation exposure which goes unnoticed. So we tell them then to avoid that and get frisked while walking into office. Girls who are working at airports, they need to be careful because there's no calibration for pregnant women. Everybody wants to be on a safety alert. So these are all hidden risks that a woman could go through. And up to week 12 is when the period of organogenesis is partially complete, and complete development of the fetus happens only at the 24th week with cardiac development. But you've got to be very careful till the end of the first trimester to be aware about your intake, then avoiding any form of sexual activity because the baby is really tiny. Any pelvic thrust can cause a bleed. or if you're exercising too much, you really don't know. So it's not that you can't exercise in pregnancy. Every patient is different. You have to tailor each one's exercise patterns. You can't say, oh, exercise allowed in pregnancy and not allowed in pregnancy. You have to handle each patient, go according to their history. If somebody's had 2 recurrent miscarriages in the second trimester, she's definitely not a candidate to exercise in the first trimester. All you could tell her is do flat surface walking.
Right.
Then somebody who's been a first-time mother, but the cervix is all fine, then she can do supervised yoga.
Right.
Or I have patients who go to Yasmin, and they do Pilates in pregnancy as well. But each one is a tailored activity and a very close follow-up every 15
And every
days in
pregnancy is different.
And see, pregnancy is physiology, it's not disease. So you got to enjoy it.
Yeah. Yeah.
Most importantly.
That's important. I think you already answered my question, which was that, what should mothers, especially in the early phase, focus on physically? And you said exercise has to be different for people, nutritionally, emotionally.
Then they feel one apprehension is about the job, second is about losing their
weight.
Will I come back to my fitness? So then I tell them that you don't overindulge in sweet stuff, and you're not supposed to eat for 2, because pregnancy is not eating for 2, but it's eating smart.
So that's a myth that you're eating.
Yes, and then stay off sugar. It's not कि आप pregnant हो और किसी ने मीठा लेकर आया तो वो auntie's got me gulab jamuns and this one got me rasgulla, this one got me brownies, so I'm going to gobble it all. No, because white sugar eventually, we all know the side effects of white sugar. So it's better to be away from white sugar, and you can rely more on the natural sources of sugar. Fresh fruit is good.
Are you mapping your weight?
Yeah, I am.
Yeah.
But I'm not thinking so much about weight. It's all about what I eat and what's making me feel more agile. Otherwise, it's very acidic. You feel bloaty. You don't feel like, move. And movement is very important. Like she was like, walking is super important. So I eat only that much, what my body requires. I don't think so. I'm yet eating for 2. And also I have a nutritionist, Rashi.
You got a nutritionist on board, after you became pregnant?
After I became pregnant, because I really didn't know what I should eat, what is good for the baby. All these many years I'd been eating what is good to keep me in a shape that I wanted.
I want to ask before this, because I also know you, but not everybody who's watching knows all these things about you. Have you always, had good lifestyle habits in terms of food, nutrition, exercise, or have you changed that since you became pregnant? Have you become more aware, and have you had incorporated any lifestyle changes?
Honestly, I think I've become more disciplined now after I became pregnant. I would indulge in some, desserts. And not that I was much of an alcohol drinker, and I'm not a smoker at all. So that kind of helped me with my pregnancy, I guess. But right now I'm eating the food that really suits my body. Earlier I would go out, eat anytime, anywhere, at any random places. But doctor, now I'm so aware of what I'm eating, and I am really enjoying the home cooked meals. And it's also portion control. So I think that this pregnancy has made me very, very disciplined.
Key word is discipline. Discipline in anything that you do, and then your after effects or your result is amazing.
Yeah. I want to come to the second trimester and the third trimester a little later, as it happens naturally in pregnancy. The first trimester, is it just in India, or is it everywhere in the world that everyone is sort of almost secretive about it? And we don't really announce.
Normally, even I tell my patients to be tight-lipped up to week 12 or 13 till we do the first set of genetic tests, which is at week 12, in order to check the first anomaly scan that the baby looks all normal. Then we check the nuchal thickness, which is the neck thickness, the nasal bone, the intraorbital diameter, and we do some blood tests in order to see that the baby is not Downs affected or any chromosomal defect. And then when that is all normal, then we tell them to stand on a platform and declare that they're pregnant to the world, because it's very traumatizing if they declare it early, and then unfortunately if they find a problem and they're requested to terminate the pregnancy or given the option of pregnancy termination, then they have a lot of people to answer questions to.
So that's the reason why most people wait until they finish their first trimester.
I just want to say, because we didn't think we were pregnant and we didn't even realize we would be pregnant, we had signed, we had to do this travel show, I and Raj, and it was, we signed the contract in December or January, and then we figured we were pregnant in March, and April we had to go do that. and we were contractually bound and we couldn't even tell them.
Yeah.
But we were very scared when we had to do it because it was a commitment.
Yes.
But it was very scary.
And it involves travel,
Travel.
international travel,
Yeah.
and doing experiences that you maybe would not have chosen to do in your first trimester otherwise.
So by the end of it, I told them that I'm not doing this, I'm not doing that. And
They must be like, why is she being so different?
yeah. And then they were like, we figured you must have been pregnant.
Yeah. But that's what I'm saying. When you're not able to share, sometimes but now that everybody knows, I'm saying, of course, now you've announced, do you feel like when it comes to work, if you choose to work for the rest of your pregnancy, even if it's not playing a character, but, just like today is not really work, but I'm saying just, doing discussions or events or ads or things that people do, will you do that? And do you feel like there's any resistance? Complications of working?
So we are also producing and our film's on floor right now. So the first trimester, I was closing the contracts with the platform. That was very hectic because it was so new. I'm an actor and I was sitting and trying to close the contracts, and that was very overwhelming. Yeah. And there were times where I had to tell them, like, listen, I can't do this because I could feel the pressure.
Yeah.
And now that it's on shoot, I don't go to the shoot every day, but whenever it's needed. But also it's just good to keep your mind active because I feel like there are days when, doctor, I'm doing nothing. And those are the days I'm just lost.
But you're not doing something. You're building a baby.
I'm building a baby, but
it's a lot of work.
Honestly, I like working. I like working, going out there, having human interaction. Otherwise, also, it's very comfortable to be in your own room, cocooned up and not...
Agree about it.
Yeah. So I'm trying to keep a balance also because I enjoy it.
Yeah.
There are many women that I know that they don't like it and they cut off, and there are many that are out there killing it.
I think that's the key thing. It's what you enjoy, and hopefully you're lucky enough, fortunate enough to have that agency such that you can do what you love.
But when I have corporates, they're working right up to the 32nd week.
Yeah.
I know, but I was thinking that sometimes
Up
people
to the 32nd.
don't have the option and they might prefer to.
Yeah.
Because it also,
Because then they want to stack up the entire leave post maternity.
Yes.
And they do pretty well. So it all depends unless they have a medical issue.
Yes. You referred to some scans, and especially you said the 12th week scan. Then there's also the NT scan that is very...
I can quickly run you through it.
Yeah, if you could just tell us
So the minute you diagnose that you missed a period and you see a pregnancy test positive, around 5.5 weeks is when you should actually do a sonography, because there's an unfortunate segment of girls who may have a tubal pregnancy.
Yes.
So you need to see that your pregnancy is well located within the womb. And you have
What's a tubal pregnancy?
a tubal pregnancy is when the baby, the embryo, does not make it from the tube into the cavity of the uterus, but it continues to grow in the tube. And the tube is elastic to a certain extent, not like the uterus. The uterus is a fibromuscular organ which is going to grow from the size of a small pear to the size of an orange, a muskmelon, and then a watermelon. But the tube has a limited capacity to expand. So come week 6 or 7, it's just going to rupture, and that could be life-threatening. Yeah. So that's the first scan. Then we have patients who have had a previous history of a miscarriage or a missed abortion around week 8 or whatever. So they're very apprehensive. So that's when they want to do an interim scan around 8 weeks to see that the baby is growing well. We keep that as an option. But what is mandatory is, again, at the 11th or 12th week to do a scan, which is the first anomaly scan or the nuchal scan, to see that the baby is developmentally all normal and that the nuchal thickness and the nasal bone and the intraorbital diameter is all well. And that's when we do a blood marker. So today we have blood markers which will tell you whether the baby is biochemically immature or not.
Right.
So whether there's Downs or not. Previously, if we saw issues with the baby, then we had to do an amniocentesis. We had to poke around the baby. But today, with the NIPT and other tests that we have, the dual, the penta markers, it's very easy to diagnose whether the baby is really affected or not.
And these are accurate.
NIPT has a very high accuracy, so I think it's always better. And we do offer that to quite a few patients. Then post that, around the 16th week is when we advise another scan, because usually patients, when they've had IVF procedures or certain procedures done prior to getting pregnant, can have an incompetent cervix, and that can be extremely distressing when they have no pain. It's a painless dilatation where the cervix just opens up and they abort. So that's the time when you can actually catch them between week 12 to 14 or 16. Once you've known that the baby is all normal, and those with a deficient cervix. So normally our criteria are such that the cervical length should be about 2.8 centimeters and more. Coming to the next scan, which is the 19-week scan, extremely important, you can't miss that at all, is to see a total anomaly scan. So that's when you check the skull, the calvarium as it is called, and the entire features, the digits. They do have certain limitations, whereas there are some babies who could be born with minor finger defects. So in any scan, you will see that not all abnormalities can be seen. That's when a sonologist will write that for you.
Right.
Then they check that the stomach, the wall, the kidneys, all the organs are well developed. For any reason, if there's an unfortunate patient who does have a malformed baby, she's given an option for termination of pregnancy before week 20, because that's how the MTP law of India works.
So week 20 is the cutoff.
Yes, and beyond that, at week 23, when we do the cardiac scan, there is an unfortunate segment again who may have cardiac defects which are compatible and non-compatible with life. Compatible with life is just an atrial septal defect or a ventricular septal defect, which can be taken care of at birth. But if it's a complex heart disease, which is going to be requiring a lot of surgeries later, then these patients are sent to a committee which is appointed by the government, and then they selectively have centers where they handhold these patients and help them with the termination process. These cannot be done routinely by us because that's a government law.
Understood.
So that's the 23-week scan, which is the cardiac scan. Then we have a 28-week Doppler scan to see the interim growth of the baby, to see that the fluid is all well and the baby is growing well and the baby does not have any growth retardation or whatever, that the placental flow is good, because we have a Doppler study. We have extremely advanced machines today so to see how the baby is growing. And the parents bond so well because they say, oh, doc, I've seen my baby so tiny and now the baby's growing so well.
I've had that app when it became from an apple seed, it became like a grapefruit, and then it
absolutely
grew
and they start to feel the quickening around the cardiac anomaly scan. So week 22 to 23 in primaries, and in earlier second time pregnant mothers may feel it even at
sooner.
19 to 20 weeks, where they feel the quickening.
Right.
So we always tell pregnant mothers that if you do not feel the movements frequently, I want the baby to move, because if the baby doesn't move, I move, and I don't like to move till week 36. So the baby moving well and bobbing well is a very good sign for me. So the first question that I ask any of my expectant mothers is, how are you doing? And then, how's the baby doing? So how's the baby moving?
Right.
So at every antenatal, I will write monitor fetal movements more than 30. So if she says that, I'm happy about that.
Yeah.
So that's week 28 scan. Then we come to week 32, when if a patient has diabetes or hypertension, we need to closely monitor them, because in diabetes, there's fluid excess, polyhydramnios, because of excessive sugars. So that's when the patient can land up in preterm delivery, or the placenta can have issues with premature maturity of the placenta, or in a patient with hypertension in pregnancy, there could be the placenta which is becoming compromised and the flow to the baby is getting compromised. So that's when we have to actually hasten up the delivery by maturing the baby's lungs. So that's an important scan at week 32. And if all is well, then at week 36 is when you can have a final scan. And if the baby is all well in the natural position, we never want to impede the natural process. And we help her and we counsel her and handhold her, and with a partography, deliver her. So partography is graphic representation of labor against time to see how she's dilating, and then we handhold her, and it's a beautiful story. So I love my obstetrics and gynac, because the mother screams for a bit and then there's a happy baby and a happy mother and a happy family.
The mother screams for a bit, it's just brushed over. Now the screams for a bit and then it's all fine.
Yeah, but the mother forgets that holding the baby, the first baby crawl is so amazing that you forget all your pain.
That's coming for you. I want to take you back to when you heard the first heartbeat. What was that?
It was the best thing. It is so overwhelming.
Who gets more overwhelmed, you or Raj?
I think Raj.
Yeah.
Yeah, he gets more overwhelmed. Also because I understand the baby is inside me and
You can
I feel it.
Yeah.
We are already connected.
Yeah.
For a father, I feel like it's a process.
Yeah.
For us,
And they don't know really
for
how
us
do I get involved? Like,
yeah,
what can I do?
Yeah,
I
what
feel
can
like
I do? Yeah.
I did something and I'm not really involved, you know, until the baby comes.
Yeah.
I want to ask you, there's lots of changes that happen to the body. You are feeling them already.
Yeah.
You know, there's backaches, there's
Yeah.
cravings that you touched upon, that vada pav was your craving for a couple of weeks. Other things that happen, sometimes insomnia. Which are the ones that we should worry about and which are just normal and part of the
I think it's very subjective because each patient will have a different list of complaints and a different list of demands. So again, it's very, very individualized. We cannot just make a general rule that, this is what is permissible and this is what is not. There are some women, like she said, her hubby is very concerned about the baby. Now, there are times when the girl comes and she screams, she's saying, "Doc, I feel like a cow," because everybody is trying to monitor what I'm eating, what I'm doing, because it's like I'm a carrier of a baby. Nobody's really bothered about my emotions. And then I tell her, "Look, my love, it's because they really are concerned about you and the baby, but then why do I feel that I'm being treated like a cow?" And then I have to make her understand that, look, it's okay. And the family is extra concerned about you, and that's about it. So I think it's the husband's extra concern for the baby as well, which makes him extra caring, and you have to appreciate him for that.
Is Raj extra concerned? Is he telling you what to eat and what not to do?
He's not telling me what. No, Raj is not that kind of a person. He lets me be. But of course, I can see how concerned he is. Also because he's been out shooting. He's not in Mumbai. So he's calling me every 2 hours. Have you eaten? Are you feeling okay?
And your mom?
My mom is just happy. She's cooking food for me. And I've been relishing it.
But believe me, this is prescription. When I talk to them and when they're pregnant, I say the husband and the wife, they need to communicate verbally and with touch.
Yes.
So verbally, if they're traveling, touch 3 hugs a day. If they need
This is 3 hugs a day.
Yes, because
Hug 3 times a day.
there's a transfer of human energy and emotion, and you have to tell each other that you care, which is extremely important in pregnancy, because in urban life we're seeing so many stress-related issues that we don't know what happens, and then suddenly they say, "Oh, when the baby came, we just withered, or we parted, or we separated, or we don't know what happened." So you got to have, it's actually prescription. And I tell the husbands, you have to brace up because your wife is going to be temperamentally on a roller coaster. So on a day that you say you're coming at 8 o'clock and you come at 8:30, she's going to say, "Oh, wow, now that I'm pregnant, you're not bothered." And, hit at, or get at the peak of her emotions. But all you need to do is just hold her and apologize and let the fizz off, and she'll be all fine.
I really like that you're also counseling the fathers.
I do
walk them
that.
through,
Yes,
because
I do that for every patient.
I feel like a lot of men sometimes don't know how to deal with a pregnant lady, or sometimes with any lady at all. But are you feeling mood swings at all? Or...
In between, yes. I felt like I was not in control of my emotions. But then...
I felt like you felt that in the past also. It has nothing to do with the pregnancy.
No, but then I was like, it didn't feel correct.
Yeah.
So I just tried to calm down.
Yeah.
And I knew that this would happen because I read it somewhere. And also, I don't know, I'm just like, good now. Touch wood.
Touch wood. Can you tell us, for some people who may not have access to a nutritionist, what are some of the things that she might like? I mean, of course, it will be tailored for you specifically, but what are some of the things that she might have told you about nutrition for a pregnant person?
She obviously told me to eat like more meals, lesser quantity. And she told me to have homemade meals. She said just avoid eating outside.
Yeah.
The vada paos that I was having was really not good because, you don't know where the oil is so much. It's fried. There's so much carb content in it. Also, then I picked up this book. It's called Garbh Sanskar by Balaji Tambe. And a friend of mine, Ira, she's a yogini, and she had told me that I must read it. So I picked it up, and there they have written very specifically what to eat. I am a hardcore non-vegetarian, and they were subscribing like one has to be a vegetarian. But I feel like protein intake for me is very important because since birth I've been a non-vegetarian.
I think also to drastically change your diet at this point.
Yeah, it's not a great idea. But other things like, I'm drinking a lot of chas, having a lot of curd, which I had stopped eating because I thought I was a young girl thinking, oh, these things make me gain weight.
So no, this is what happens to girls with PCO who conceive. Then they think, oh, dairy is not
dairy.
Yeah. So it's a myth, but in pregnancy,
but
of course.
Even in dairy, curd is a side. Curd is always good for you.
So chas is very good. Like what you're doing is very good. Greek yogurt is amazing. And eating anything out of a packet is avoidable. So, and of course, the snacks like a bakarwadis and chaklis and all should be avoided. Anything that's a fresh snack, fresh nashta, which is upma, poha, an open sandwich, avocado toast.
And how do you avoid gestational diabetes?
So there you go. Gestational diabetes is a condition wherein a girl who's never ever had altered sugars is landing up with high sugars, and which is totally dependent on the pregnant state. And 6 weeks later, her sugars are all going to come back to normal. But because this high level of sugars can influence the baby and the mother, more so the baby's outcome, in pregnancy, you need to control that. So we have certain tests, which is called the OGTT, oral glucose tolerance test. So if a girl jumps her weight, or she has a family history of diabetes, or is starting off as an obese girl with her HbA1c being high, we need to do the oral GTT to see how she's being able to metabolize her sugars. Normally in PCOS, we put them on glycomet almost through pregnancy to avoid too much of weight gain. So that's what helps them against gestational diabetes, because PCOS are at a risk of gestational diabetes.
Are there any vitamins or supplements that you have to take?
My doctor has prescribed me a calcium, an iron tablet, and fish oil.
Fish oil.
Yeah.
Are there things that one can do, for postpartum care and breastfeeding and things that you can eat or take that will support your nutrition?
So before I come to that, in early pregnancy, you need certain supplements like folic acid and B complex. We normally give it to girls even in the preconception period in order to enhance the egg quality. And till the 12th week is when they should take the folic acid and B complex. And if they are going to be hormone deficient, then we don't mind giving them a hormone supplement. And also something to prevent pregnancy nausea, because if that hits bad, then it really can get to a point where they get dehydrated. So then these are the 4 supplements that we normally like to give in early pregnancy, besides any issues if a patient has bleeding or a subchorionic bleed or some problem where you think that it could be a threatened abortion. A threatened abortion is when a patient has some spotting and there's a chance of losing the baby, and you can do everything to salvage the baby in utero. So that's when we have to give additional drugs. But the basic supplements are folic acid, B complex.
And there's safe medication for antenatal.
Absolutely. Then once you enter the second trimester is when the baby starts to extract all your iron and calcium. Baby's not bothered. What is mother's baseline level? Is mother thalassemic? No. Baby wants to come out with a hemoglobin of 16 or 17. So mother's hemoglobin may be 9. I don't care. I want my stuff. So we have to start replenishing her iron stores. Space your iron and calcium. So if you take iron in the morning, you take calcium in the evening, at least 4 hours apart. Otherwise, they chelate each other and they get passed down the drain. You need a multivitamin like a B complex with a zinc also, omega if required. In addition to this is if there are patients who have a problem with growth defects, then we have to give them some nutrition supplements like RG Preg or some protein supplements. That's just to see that the baby's serial growth picks up well. If there's hypertension, you need to give antihypertensives. If there's asthma, you need to give asthma.
Those will be specialized according to what?
Diabetes, you need to then control them or show them regularly to the diabetologist or the endocrinologist. And thyroid medication, of course, you need to supervise. Any patient with a high thyroid level in the first trimester can have an issue with the baby's development. So you have to check on your thyroid levels and see that you're euthyroid before you conceive and through the pregnancy as well.
You want to say something about supplement?
Yes. So D3 deficiency is something that is very often encountered in pregnancy as well. So we do monitor their D3 levels, and usually the D3 should be about 35, but I like to keep it at about 50. So it keeps you resistant to infections. It keeps your immunity high. So in patients who are really D3 deficient, typically they'll complain of backache, bone pain, tiredness, fatigue, and increased susceptibility to infection. So that's when we tell them that you need to keep your D3 up, and then we monitor the D3 levels in the 3 trimesters as well. Also, their immunization in pregnancy is important.
Yeah.
So a tetanus shot at week 16, then a Influvac at week 19, then for lung maturity, where indicated, we need to give a betamethasol injection, but at week 34 is a Tdap vaccine or Boostrix for tetanus, diphtheria, and pertussis for the mother's and the baby's protection. So this is essential immunization in pregnancy.
I'm just thinking about all these people who were on islands without any access to doctors and how they did it. I want to ask because, of course, we spoke a little bit about how women do worry. One of the things perhaps they shouldn't worry about is how their body changes. And we continue to, even after you have a baby, our bodies never really go back to the way that they were. And that's okay. I mean, we built a baby, delivered a baby, etc. But exercise is permissible. Are you exercising? Were you always into fitness, and are you trying to continue to?
I was always into fitness. I mean, I went to a boarding school where just going for a jog every day was such an integral part. So when I was 10 till the day I conceived, I was working out every day.
Yeah.
Also, I love working out. But the day I went to my doctor and she figured out that I was pregnant, she said, for 3 months, you can't do anything. You could only walk.
Yeah, flat surface walking.
Flat surface walking. That got to me.
Yeah.
I was like, I don't know what to do. I needed that boost of, energy. But of course, I kind of stepped back.
Yeah.
That was a really difficult time. Then I did my scans, what doctor said, after my 12th week. And then my doctor was like, go ahead, start your prenatal yoga. And after that, I felt comfortable. So I went back to doing Pilates, which I had been doing all my life. So now I'm just juggling between prenatal yoga and Pilates, but nothing hardcore. Anything that makes me uncomfortable, I stop.
I've seen, videos of people doing weightlifting and marathon running and things, and they say,
My darling, what did I say? Everything is individualized.
Right.
You may have somebody who can even do a treadmill in pregnancy, but you may have somebody who has to be absolutely flat on bed. So it's extremely tailored.
But what are no-nos? What are definite no-nos? Headstands, handstands, inverse?
Absolutely not. No headstands, please.
Okay.
So flat surface walking, and actually what we have is now exercise specialists on board in the corporate hospitals that we work. So we refer them to the concerned person, and then she of course interviews them, and then she tailors their exercise pattern. So I think flat surface walking, what you're doing is amazing. You can do a little bit of breathing, but there's again in yoga certain breathing exercises which are permissible and which are not. So you can't do a Kapalbharti, but you can do an Anulom Vilom. You can do meditation. You can't do a cat camel, but you can do a little bit of a butterfly. You can do Malasan. So Malasan is something where you sit on your feet and you try to deep squat. So where it's permissible and a patient can do it, it would be allowed. But otherwise, I think flat surface walking is something that is good, and monitored, supervised exercise, of course, permissible.
I think this whole journey has to be a little monitored.
But if you go and you see somebody on internet and say, oh, this celebrity was doing this in pregnancy and I, of course, can do it. No, please don't do that, because it could have detrimental outcomes.
I think this question you've already answered. I asked you about any lifestyle change that you've made, and you said your lifestyle was already pretty decent. But the one thing that you're doing is perhaps just being careful about not eating out.
And not eating too much sugar. Not eating fried food at all. I think my pregnancies made me more disciplined. And I always told you not to have that glass of Diet Coke, didn't I?
No, and I've stopped.
Every patient is cosmetically aware. So after week 12, I tell them to take utmost care with their skin and start applying their cosmetic creams and stretch mark creams. And have a bath with a heavily moisturized soap so that you provide as much elasticity and collagen to the abdomen, and then you increase the number of times you apply these creams in the second and the third trimester. So believe you me, I don't want to boast, but our girls who start off at week 12 have absolutely no stri on the abdomen. Of course, there are some
Stri or stretch marks.
Stretch marks or stri. And post-delivery, they're called stri. But absolutely, if you take care, because it's like a balloon. If you stretch it beyond its capacity, it's going to shrivel. But if you start to give you your cosmetic care from the beginning, so lower abdomen, upper arms, breast, buttocks, thighs, and the flanks are the areas which you can actually.
And what can you apply? What are
the body butters, the anti-stretch mark creams, the oils? There are so many now available on the net. You can use any, but you have to do this skincare, which is really gratifying. And then I tell them, look, you're going to be able to sport a bikini with your kids.
Yeah. I feel like you were though born with great skin. It's genetic for you, but how you...
So I've been using a lot of vitamin E oils.
Yeah.
I've got some anti-stretch mark oils.
Body
as well.
butters.
And also the other day I was reading coconut oil is really good. Is it, doctor? Should I?
Any oil that can give you the comfort and give you that sort of elasticity is good. But your soap, you cannot use cake soaps. You have to use liquid soaps because they have more than 60% moisture, so they don't dehydrate the skin. And today we have so many of them in the market which are very good, which give you a lot of moisture. So that works. Especially hypothyroid patients are the ones who suffer a lot of dry skin. So they need to take extra care.
I want to come to the duration of pregnancy. Typically, it's 40 weeks, 38 to 40 weeks. Why is full-term pregnancy important? When is it considered good to go? I think you already referred to that earlier. But that timeline, why is it so important? And what happens when a baby is born prematurely?
So let's go back to the trimesters. So we divide pregnancy into 3 trimesters. The first 12 weeks, then from the 12th week to the 27th week, and then the 28th week to the 40th week. So any baby coming out before the 28th week is obviously going to have problems of prematurity. So there could be hypothermia, there could be breathing difficulty, there could be problems with their sodium, their electrolytes, they could have cataracts. So the earlier the baby comes out, the more the problems. Though, like I emphasized earlier, we have centers wherein they have salvage babies. So at times there are unfortunate patients who have had a IVF pregnancy, and for some reason the bag of waters ruptures at week 25.
Right.
What do? We can't just tell them that you're going home with an empty cradle. So that's when the tertiary care centers come into play. And we have amazing people behind the machines with more than 40 years of experience. In Surya, we have salvaged babies who were like 4 and 500 grammars.
Wow.
And they've been like, they're now beautiful girls in Hyderabad going to dance school.
Wow.
And the neonatologist used to give them the worst story, the parents every time has to say, just keep quiet and just go and listen to them and just pray and all is going to be well. Yeah. And believe you me, they've done beautifully well. But what our desire or our principle of management as obstetricians is to see that all these babies can touch term, which is week 36 and above.
Yeah.
By that time, the entire maturity is good. The baby is at a decent weight. And we say the Indian average weight of a baby should be anywhere between 2.3 to 2.6 for a good natural birth. But once the weight starts to increase, then the cephalopelvic disproportion happens and the babies can get stuck or babies float, they don't go down into the pelvis, and then they land up with a higher incidence of cesarean section. So very commonly asked question is, doctor, why is it that the cesareans have increased in clinical practice? Because today my babies in clinical practice, if they don't really take care, the baby weights are hitting 3.2, 3.4, where the physical frames of the woman are
narrow.
And the average Indian height is at 5'3" or 5'4". So the baby has to combat 3 diameters, the inlet, the mid cavity and the outlet. So if the inlet is where the baby's head is not being able to go in, you obviously can't induce labor. And when the baby is showing you on your graph, your NST is that the baby is getting smothered. So there's no way but to deliver a baby with a cesarean section.
Does thinking and talking about childbirth make you nervous or excited?
No, not at all.
It's making me nervous now to say.
I feel it's just a natural progression to it.
Yes.
Pregnancy. And I don't know why. I'm not thinking whether I'm going to have a natural or a cesarean.
Yeah.
I'm sure both will be equally painful and joyous by the end of it.
I mean, it will be an experience.
So, yeah, it'll be an experience. Whatever.
Choice of making it painless if need be. And it's quite well monitored. So it's not really impeding the natural process. If you feel the pain is coming in the way of your natural birth, you can opt for that as well. You can actually meet up with your anesthesia team prior to delivery in your 3rd trimester. If you show all natural signs of going into natural labor, you can choose that as an option to kind of alleviate the pain and give you a natural birth.
But doctor, how do you guys figure out whether this woman is going to have like a natural birth or?
So at week 36 is when we do a scan, and by that time the position is almost fixed. If you see at week 28, 25% of the babies are in the breech position where the buttocks are down. But come week 36, most of them naturally rotate and the head goes down. So if for any reason the baby is malpositioned, like if it's a breech where the buttocks are down, or if it's transverse or an oblique, or there are twin pregnancies where there are 2 buttocks down. Of course, twin pregnancy is not an indication for a vaginal birth at all. So if we see everything normal and natural, where the baby weight is average, there's no risk factor in the mother like hypertension or diabetes, after week 36 is when we start to do an internal checkup. And the cervix, the mouth of the uterus, normally has to start shortening. So at week 36, if it's tubular, then I tell them to come back in 10 days. If it's getting short, then I say, okay, come back in 5 days. If it's short enough and opening up, then I say, okay, time to get admitted. Time to get admitted. And then we follow it up with an NST, which is a graph taken in the 3rd trimester, a non-stress test, which tells us how the baby is doing. So we have 2 graphs. One is to show uterine activity and the second is to show fetal well-being. And then we don't impede the natural process. If a patient is a good patient to undergo a vaginal birth, we sit and counsel her and tell her, look, we are going to handhold you and give you a trial of labor. So what is a trial of labor? That keeping everything ready for intervention if required, if you or the baby go into distress, we want you to have a nice and a natural birth. And today we have doulas. They can help you with your pregnancy, birth, elevation and your breathing, and we can give you. There are people who also do underwater births if required.
Have you ever been there at an underwater birth or a water birth?
I've not. I don't specialize in that because honestly, today, if you ask me, ideal situation for holistically delivering an underwater baby, we do not have those kind of setups over here. So I have not ever even ventured there. But of course, epidural with my anesthesia team. In fact, my dissertation topic in KM years ago, when I was in KM in Wadia in 1991, I had delivered 35 babies through the epidural with painless labor, and that was a very, very gratifying outcome.
Wow.
So if you actually educate a patient that, look, this is a contraction, don't worry, and you do not need to push till we tell you to push. And when is the time to push is when the cervix actually dilates 10 centimeters. And that's when you push, so you don't get fatigued, and it's so nice and natural and beautiful. And you're monitoring the baby's well-being. So
everyone's listening. Who's listening? They're too busy screaming.
Yeah, and to keep them comfortable and pampered and music and giving them some pats. And
have you got a song you want to listen to? You want Raj to sing to you when you give birth?
Not yet, but sure, I'll have my playlist.
You have to have a playlist.
Yeah.
cologne sponges to keep them feeling fresh. You know, you tend to
sponges?
Yeah, so like a UD cologne.
I think like a cologne sponge.
No.
No, I was like, what is that? Cologne.
No.
Where is the strangest place you've ever delivered a baby? Or has it always just been...
Where is the strangest place?
Yeah.
Well, I was in my rural posting in Kurla. This is way back in the year 89, and a woman came with a baby in her salwar.
As in she'd already delivered the baby?
Yes. So the baby was stuck in the salwar, and it was a strike day. So, and we had gone into the compound because there was a hue and cry saying the nurses are on strike and what to do. So I ran down, and then we ran with a scissor and cut open the salwar and got the baby out and the afterbirths out, and of course made the mother comfortable, and luckily she had not lost blood because this was baby 7 for her.
Baby 7?
Yes. So 7th baby, she was delivering vaginally. So that's when the baby came out so spontaneously, but was at term, but baby was wonderful, cherubic, crying well, and all was well.
So doctor, my grandmother had like 7 children, and my other grandmother had like four of them. How much can our body take it? How many times can we actually give birth? And what is good for like a normal working girl in India today? How many of them?
Well, out of choice, ideally, I think one should have 2 kids. But I do see a lot of patients who I do cater to from the Middle East as well. And I have seen patients who have had 14 and 15 kids through their entire obstetric career. So there are patients yet who do have, and they are in labor with their daughters around the age of menopause as well. So you do see such situations.
Some impact on your body? Like a negative impact?
It does, but there are women who are multiparous to that extent, and we have seen para 14 as well. But today I feel if you want to give your child the best and you want to get back to your career and your physical well-being, I think 2 babies, if you can afford it, is amazing, because 1 child can be stubborn. Don't take my message otherwise. Because you have good cousins for your little one to vibe as good as siblings, and you have a well-bonded family. But single kids in nuclear families can have issues with development. And we have to handhold those parents as well. So I always tell my patients that my bond with you doesn't end with me giving you a baby in arms. So when my kids are almost hitting university, the parents call me saying, oh, now she's having a problem with this issue in uni. And then I sit down and I talk to them. So that's the bond I share with my patients.
I was reading somewhere that it's, a lot of people are now getting anxious when it comes to having children. Infertility is not really the problem, it's interesting that the same person has had an unwanted pregnancy when they're younger and then feels like they didn't have as many children as they wanted to have later in life. So it's about the timing that people are struggling with now. And I think that people want to have children later in life. It seems to be
No,
at least
let me tell you, the latest trend is they don't want to have babies at all.
at all.
No, they want to have pets. They want to keep pets. They're spending on Shih Tzus and Maltipoos in lakhs.
Because
Just that they don't want responsibility,
But
and
that's
they're
also
living.
responsibility.
Yeah, but then
they feel like it's not her,
yeah.
a baby.
So this is the latest trend where they feel they don't want the responsibility of having kids at all. So we do have that segment in society as well.
I mean, I feel like not everybody needs to be a parent, and it's all right if you don't want to be, and some people perhaps shouldn't be parents. But
And it's not that they have any physical issues or financial issues,
choice.
but it's just a choice.
But for those who do choose to have, and as we get towards the end of this, those who are choosing to have children later in life, is there something that they should be cognizant of or something that they should work on before they get pregnant?
Oh, later in life, I told you the biological clock is something that the woman has to look at.
Yeah.
Because the later you conceive, the more the issues.
Yeah.
Instrumental deliveries, more cesarean sections, more metabolic issues, more close follow-ups. And of course, they say if you have your babies at an earlier age, then you age less. So.
Yeah. So, as you know, my friend Ninna has a question for every episode that we do. And she asks a question and then, we tell her if she's accurate or not. So her question to you, Dr. Dhanu, is that, is it more difficult for women to conceive today than it was in a previous generation or in our mother's generations?
Definitely a yes. I'll give you my reasons why. Like I said, first, promiscuous behavior leading to tubal blocks and sexually transmitted disease, causing problems in the urogenital tract, cervical infections. A higher incidence of PCOD and lifestyle diseases and obesity leading to hormonal issues. And in conception, the diet patterns, which are eating out of a packet. It's so sad. Let me tell you, I was operating with my breast cancer surgeon the other day and I asked him, what's the youngest that you've seen recently? And he said a 12-year-old with a breast cancer. And that is with bad lifestyle and bad eating habits. So I think that is also something to be concerned about. Then they also have financial issues, if at all, or job pressures. They don't know where to give up their ambition as far as jobs are concerned. And then you have to handhold them, sit down, counsel them, and then, of course, understand the importance. And the women in the past used to do a lot of physical activity. So even if they had hormonal issues, with the amount of physical work they did, they combated it with weight loss. But today with sedentary lifestyles, then it becomes very difficult. Plus girls with habits, it's very sad to see so many young girls smoking, vaping, substance, alcohol. It is unimaginable what happens over weekends. And then I insist that they cleanse their bodies. If they're actually coming to me for pre-marriage counseling, then they have to actually sit down and ask about habits. And if they are into habits, then they have to get rid of these habits, check that their levels are all clean, and only then we allow them to conceive. So these are all the issues that we are facing today.
Right. So Ninna's correct. Patra, I wanted to ask you, because you're an actor, you're in the public space, and you announced your pregnancy, and there would have been a lot of attention. How have you been protecting your emotional space and navigating that public attention?
I haven't been navigating it. All the messages that I've been getting are just happy messages.
Yeah.
So I read all of them and I just feel like there's a lot of love coming our way.
Yeah.
So there's nothing to really navigate. And I'm just happy that I'm sharing this most important journey that we both are about to take with everyone. So,
and through this journey, who are like your emotional support, like the people that you lean on or are there for you? I think we do depend on people and sometimes share and require people to handhold us through it.
yeah. I feel my husband is my best friend and he's with me.
Yeah.
My mother is great. She's always there for me. And I've got some amazing set of friends.
Yeah.
You know, I always reach out to you if there's an issue. So I have my
Support group.
Yeah.
And I feel like that's the most important thing to have while you're taking on a pregnancy journey.
I agree. I think we need to see more of you, though. Okay, just a couple of things at the end. I want to bust some myths because there's some pretty strange myths out there when it comes to pregnancy. One is it true that if you've taken birth control for years, it delays your ability or it makes it complicated to get pregnant?
No, in fact, it's pregnancy or it's fertility enhancing. Understand that a pill is going to keep you anovulatory. And remember in the beginning, I said your basket of eggs. So you are not releasing those eggs. So you are actually having your eggs stored in your ovaries. So if you're taking a combination pill, it's beneficial, it's fertility enhancing for you. So much so that a sudden stoppage of pill can give you an easy conception.
What about taking too many morning after pills?
That's dangerous.
Like a lot of people might.
Extremely dangerous.
Does that affect your fertility?
It does affect your fertility. It affects your uterine lining. It increases your chances of having tubal pregnancies that we spoke about because it makes the uterine lining hostile. Understand that the eye pill is not something like a contraceptive. It's an interceptive. The egg and the sperm have already met and it's just making the uterine lining hostile to implantation. Right. So instead of falling off from the cervix, the egg bounces back into the tube and it can bleed over there and it can be life-threatening to a patient. So the eye pill is a definite no-no unless taken under medical supervision and very closely monitored. So do not please pop in eye pills at all.
Are there any natural fertility boosters out there or is it just marketing gimmick?
Natural fertility boosters, I would say, is basically your folic acid and B complex to actually make your ovaries healthier. Keeping yourself metabolically fit. So if you actually want to go in for a pregnancy planning, then look into your parameters. But if you've accidentally gotten pregnant, then you check on all your parameters as soon as you get pregnant. Like I said, the thyroid and the sugars can have lifetime implications with genetic defects if you don't monitor them in early pregnancy.
No, but I mean those juices and those laddus and the milk and the haldi.
Oh, well, very good. You spoke about laddus and oh my God. So post-delivery is when I tell all the mothers and the mother-in-laws that the panjiris and the laddus was for women in the past who were catering to a family of 40, who had 8 children.
You're not getting any laddus.
Trailing behind them. And that is when the mother used to come with nutrition-packed laddus. But today you give her a healthy and a simple diet. If you want to give her dry fruits, it can be just soaked dry fruits, which could be good. Ghee in proportion, 1 teaspoon or so. But that panjiri and the stuff that you give her is only going to make her obese and make it difficult for her to lose weight and in fact increase stretch marks, which she's not had in pregnancy, by making her put on too much weight. So that's something that we need to tell the support group at home because they feel whatever is given to the mother is going to pass down to the baby and make the baby cherubic and healthy looking. But no, there's a certain amount of fat that passes through breast milk and the rest of it is all going to the mother's butt and the arms and the waist. So
are you eating these laddus? Not after today for sure.
No, I'm not eating that.
That's as far as the dietary counseling is concerned. But whenever and to date, believe you me, or you can see most of my testimonials, most of my patients, everyone who's delivered with me has a half-an-hour counseling session when they go home. And that's all about parenting and how they should take care. And I tell them all that I want one promise from you when you leave the hospital, that this child needs your financial and emotional support.
Yeah.
Do not ever think that you're financially capable of taking care of this baby so you can raise the baby by yourself. Because if you have had the responsibility to parent, you should bundle your ego and chuck it in the Arabian Sea and see to it that you provide for this baby financially and emotionally.
Yeah.
It's very traumatic when you bring a child into the OPD and say, oh, choose between parents. And you believe, you're so surprised because a 5-year-old starts to talk like a 15-year-old.
Yeah.
And that's very traumatic. So when you have decided to parent, you have to understand that your egos have to be bundled and thrown into the Arabian Sea or whichever sea you are closest to, and parent the child emotionally and financially till you breathe last.
No, thank you.
Extremely important.
I think what I love about you is that, it's not just the medical advice. It's so much about just...
No, clinical practice today is, I was just talking to Anjali and I just told her that clinical practice today for me is not just looking into the uterus and hormones. It's mentally connecting with their issues, talking to them about their lifestyle and then talking to them about their physical issues.
So, closing questions. You, Patra, if there's one piece of advice, I know you don't like giving advice, but because you're here and it's your last question, think about it. If there was one piece of advice that you would want to give women watching who are trying to get pregnant, who are on the cusp of getting pregnant, what would you want to tell them about their impending pregnancy journeys?
Don't smoke. And
Don't smoke.
And don't drink.
There you go.
That is very good advice. I'm really hoping that they're not smoking or drinking.
Yeah.
Anything else?
No.
Assuming that they're not smoking or
don't drink and eat. Have an active lifestyle.
Yeah.
Because right now, like doctor said, we all have such a sedentary lifestyle.
Yeah. And Dr. Dhanu, if there's a woman who is trying to get pregnant, but it's not happening, what is one thing that you might say to her to encourage her?
Depends on her age.
Yeah.
If she's young and if all is well, then I say go by probability of conception. By which I mean, if the girl is about 25 or 26 and the boy is 27, 28, all normal, no habits, I say go ahead and have your normal relations. Of course, leaving alone the period time when you see red, you don't have any intercourse because that could lead to tubal issues later. And of course, suppose I have 100 couples in Jan who are all normal and they have sexual intercourse. Not all 100 are going to come back to me pregnant in February. So that's the probability of conception. So 15% in Feb, 30% by May, 45% by August or September, 75% by November. And those 25 or 20% that remain are the ones who then actually need to be looked at for infertility. But if it's an older patient, then I don't say probability of conception comes into play. Then an immediate ultrasound, an AMH, hormonal test to see where you are. And then you plan because your biological clock is going ding dong.
Right.
So it all depends. It's again individualized.
Okay. And sorry, last question. Is there a golden rule for a happy and a healthy pregnancy?
Yes. So healthiness in mind and body. And what I feel at home, and that's what I tell all my couples, is the success story today is a smiling wife, gurgling kids, decent food being cooked in the house, decent luxuries, and a husband hugging a wife and telling her that I love you and I'm so happy to have you by my side. And the woman also telling the man that I'm so happy to have you caring for me. And believe you me, this communication works.
Three times a day. Three times a day
And complimenting each other and telling each other that I love you and I'm so thankful for having you by my side. It means a lot.
I see that. I see that in your house.
So that's the success story. Financial success is not domestic success.
Yeah. So, promise, last question. Yeah. What is one thing that you're looking forward to? Not about pregnancy or your third trimester, but about motherhood.
I want to hold my baby. I want to cuddle with my baby. And I'm also very excited for my two little ones, Alu and Lucy, my pet dogs.
The dogs. Oh, yeah. Oh, God. I have to be that.
Yeah, you have to be.
I mean, whenever you're ready to have people.
What breed are they?
They're Yorkshires and they're tiny and they're always around me, guarding me.
Yeah, I'm very interested to see how things
the dynamics. Yeah.
But I have to thank you both for just giving so much of your precious time, Patra. It's such a special moment in your life and a journey, and it really means the world to me that you were here today just to talk about it a little bit. And of course, I'm going to see lots of you over the next few weeks. And Dr. Dhanu, always amazing.
It's a pleasure, my dog.
Always such good practical advice, so much clarity, so much knowledge.
Thank you.
So thank you both, and really.
And all the best to you, my dear.
Yes.
Jen, you're honestly amazing. Yep. And you're glowing. So you're doing very well.
Thank you, doctor.
Thank you. Thank you so much.
Thank you.
Pregnancy truly is a journey filled with change. It's filled with emotion and hope. And I really hope that today's conversation will help many women feel seen and feel supported. To everyone watching, do remember that every single pregnancy is unique, like Dr. Dhanu said. Every mother's experience is her own, like Patra said, and it's okay to take it one day at a time. So here's to a healthy, happy beginning and embracing this very beautiful chapter of life. Until next time, stay informed, stay healthy, and we will see you in the next episode.